Welcome to Why Should I Invest? Developed by the International Collegiate Angels Network, or ICAN. At ICAN, we believe that campus-born ventures are today's most underappreciated asset class. Each podcast will spotlight a campus-born founder and the venture they're building. I'm going to ask the tough questions that investors would want to ask. I'm here today with Dr. Liz Hatz and Ken Krull of GLR Medical Innovations. And welcome to the show. Please, Ken and Dr. Liz, please introduce yourselves and introduce your company.
Sure. And Ken, actually, if you want to start, then I will launch right into the product from when I introduce myself and how we came about.
So I'm a 10-year tech executive, taught at university level as an adjunct, and part of that process spent 10 years in venture capital, during which I was chairman of Biomicro, which we sold to Roche, which is how I met Liz. Liz and I started talking about her company in that context. And I'm the chief operating officer at GLR.
And I'm Liz Hatz. I'm a family medicine physician. I met an engineer, George, when I was at the end of residency, and we just got talking about products that could make a difference in the medical world. He's post-polio, and so he had invented some things that help him and help his mobility. And then we got talking about women's healthcare and the catheter world. The only catheter that was available at that time is the Foley catheter that's now marking almost its 100th anniversary, and there hadn't been any innovation to that product. And we sat over sushi and drew on napkins and created a pretty cool idea that covers a lot of the problems that we found existed with the Foley catheter. One of those things is infection reduction, and another of those things is wearability, portability. And we'll talk a little bit more about all those details in a bit, but that's how we got started, is George and I just chatting about some things that are missing in the healthcare for women.
Well, it's got to be $1 billion opportunity if it was drawn out on a napkin, right? I mean, that's the origin of all the $1 billion ideas, isn't it? Yeah. So tell me a little bit about. I mean, I know UTIs are terrible. I've had one in my life, and I absolutely was probably the worst thing I've ever had. So tell me a little bit about the Foley catheter, and I understand how it causes UTIs, but just tell us a little bit about, are there other complications with respect to the Foley catheter?
Sure. Well, and the Foley catheter will always have its place, but it is an indwelling urinary catheter, which means that it goes inside the bladder, in through the urethra, in the bladder. Anytime we enter the urethra like that and into the bladder, we create an opportunity. I mean, UTIs are already waiting to happen, but you create an opportunity for those bacteria to get through on the catheter itself into the bladder. And it's such a big problem, actually, that is called, there is a category of those specific types of UTIs called CAUTIs. They're catheter-associated urinary tract infections.
Sure.
And they're one of the most common and most deadly bacterial infections that are acquired in the hospital. Uh-huh. So it's a really big problem. The catheter, the good thing about the Foley catheter is it anchors, so it stays in the body. But what we decided was that a vaginal anchor would not introduce bacteria the same way, and it would also hold the catheter to the body. So we have a truly unique product that is both able to anchor to the body and be wearable, mobile, but then also not go into the urethra.
Right. So your product is primarily for female applications, right?
Yep.
And so tell us a little bit about where you are in the product development cycle and kind of what is the status and stage of the company?
Sure. And we have a really great prototype. We've applied that prototype also to electronic. We have electronic, like a electronic bladder, and we can do all sorts of testing and have tried and tested this prototype to just make sure that it not only works for its own functioning, but then also we can use it for many applications in the future that have that record data.
Right. Now, since this is a problem that is clearly been recognized for a long time, why do you think Stryker and Becton Dickinson haven't come up with an alternative solution to the Foley in the past?
Well, there is a little story about that, but they've tried. They've tried. I just don't think it. Nobody has come up with this particular
Didn't have the
idea.
right napkin, I guess, huh?
I guess, or maybe just weren't thinking necessarily. Nobody really has thought about this, and truly, we have patent coverage because nobody has thought of this idea.
Right.
And the patent coverage is very specific and very broad, both of all the things that we captured that nobody else has put on paper, as it were.
Okay.
About the time that Liz was filing patents for her device, Stryker and Becton Dickinson went down a different route that was similar, where they actually vacuum urine out of the air. And you can imagine how well that works. But they do make a couple $100 million a year doing that because it's such an incredible problem.
Right. And so let's talk. You brought up the market potential for this thing. What do you think is the addressable market for this product?
The total addressable market?
Yes.
Probably $30 billion.
Just
$30 billion on the women's side.
Okay.
Serviceable available market in the United States, probably more like 10. Mm-hmm. We're going to try and get 1.5 as an original target for us at GLR.
Okay. And you mentioned in this paperwork that I have that you are setting up for some usability trials.
Yeah, that's correct. We have a couple partners that have offered to assist us in those. We've done, Liz mentioned we had a lab prototype. We had them 3D printed. We actually used those with an internal pilot and had a half a dozen women use them.
Okay.
Most of the results were really positive. A couple women were like, well, if you make them out of medical grade silicone, that would be better. And we said, absolutely, that's the go-to-market plan. We need to build 100, plus versions of that medical grade silicone, inexpensively molded version, and then run those through an efficacy trial just to make, to basically tell the FDA that we can pass urine. Now, we don't need a FDA clearance because we're a class 2 exempt device on one end and a class 1 on the other side that passes urine. So we'll just do a quick Q submission with the FDA, but we do need to do this efficacy trial to make sure that the sizing is right for a broad set of women, much broader than we've worked with in the past.
Mm-hmm. And you think that the hospital application of this is the one that you want to pursue with your initial market entry?
It is. We got that advice from one of our senior advisors who works in a major medical device company and said, look, go after the highest margin products first, do the heavy lifting to be able to get kind of the superset of folks that are most difficult to close. Start out with a high margin product and then work your way down to all the other segments. And we would have to agree that's a smart approach.
And what kind of barriers do you see in terms of selling into that hospital channel?
We don't know how Stryker and Becton Dickinson are going to respond, right? It's possible that because they compete against each other, we might be able to pick one up. Certainly, B. Braun is a larger competitor in this space, and they don't have anything that's marketed as an external urinary catheter. We love the fact that both Stryker and BD went to the trouble to market and create a space for an external urinary catheter, even though they don't actually have one. So that's great for us.
Yeah, so you think you would partner with somebody, maybe a value-added reseller of kind of relationship, or?
Yeah, so we'd probably pick one of the other traditional Foley catheter companies that has a broad distribution channel.
Okay.
And we would either OEM through them, or we would have them sell under our brand.
I see. Okay, great. And you're looking for $2 to $4 million in the current round of financing. Is that correct?
That's correct. So we'd like to do a $2 million convertible note on a $12 million pre-money capped equity round. Okay. Obviously, could be lower than 12, but
yeah. And it indicates on here that you were trying to close the round by May 1st of 2025. Maybe I have bad information here. The round is still open.
We have soft commitments, but we don't have. We're not fully funded. So
okay. And what how are you going to use those funds?
So mostly we're going to be building the product through this efficacy trial, right? We need to, we have a design partner, and the design partner is committed, probably for equity, actually, to build a set of product and do the product marketing to be able to run this efficacy trial with the one hospital chain and one large insurance company. But
Okay.
we're basically going to be doing all of that design work, all of that the lab prototype testing. We're going to be going to manufacturing, but we expect most of the manufacturing cost to be borne by one of four different providers who've offered to do so and basically take all of their upfront. It's a relatively simple device to manufacture, but they want to get paid and willing to get paid out of margin, which is great for us as a startup.
Yeah. Where do you anticipate you're going to be doing that manufacturing?
So the four options are in different locations. Our advisor likes a location in Costa Rica. They're all FDA approved locations.
Yep.
One of the locations is foreign owned, but in the United States. And we actually have one of the locations, which is also interesting, is in China. We filed and got our patent protection, which is very broad, in 2020, and the patent laws changed in China in 21. So recently, some Chinese entities have reached out to us saying, hey, we'd like you to extend your patent coverage here. We'd like you to do design patent work here. We'd like you to have a joint venture in China and do that work here. So we're still considering that.
Yeah, that sounds very interesting. Well, if you close your funding round, let's say everything goes well and we get this closed by the end of August, September, how long before we are manufacturing and going to market and going after it? Hitting it.
So a conservative engineering approach is 3 years.
3 years.
Our internal plan is about half that.
Right. And Stryker and Becton Dickinson, are they aware of your presence?
Some
yet.
people inside of those organizations are aware.
And they're watching, keeping an eye. I looked on your exit strategy, and you mentioned that, getting acquired by maybe one of those big guys might be something that would happen.
We think they're not as big as some of the other folks that are going to be interested in this product, and they actually have a product that competes against each other. There was a lawsuit between Becton Dickinson and Stryker. Currently, Stryker pays royalties to Becton Dickinson because they bought the PureWick device while Stryker was looking at it. So
I see.
It's a heated and competitive market. I think we're in a great position.
Yeah, it sounds like it. This has non-clinical applications as well. I noticed that you mentioned that it also could be used for incontinence. I mean, would that be like a B2C sale?
Yeah.
Liz is nodding her head. Liz, is that... you mentioned that you wanted to go after the hospital market first, but expansion would be into the B2C?
Yes, absolutely. There are actually quite a few applications for this product. Incontinence is one of those. But just even personal use, the women physician groups that I'm on, people are always talking about, they wish that they, could put a Foley catheter in so they could go to a 3-day concert or, go on a trip that they're going on or these sorts of things. And I mean, you could potentially do that, but with all the complications, this would be a personal device that anybody could use.
Right.
If, they could use a tampon or a menstrual cup.
Okay. Yeah, you don't need to be a clinician then to apply this. Simple. You don't need to be. You can. Okay. So you could see this on the shelves of CVS, Walgreens, potentially.
Absolutely.
A B2C play.
Mm-hmm.
That's interesting. Okay. I don't have any further questions for you. I just want to make sure that you have a chance to make. As I said, I'm not a domain expert in this area. Is there anything I missed that you would like to bring up for our investors?
We talked about the patents. The patents are granted in North America and in Japan, and they're pending in Europe. Mm-hmm. And again, we have a plan to extend into China and pick up what we originally couldn't protect in 2020.
Mm-hmm. Interesting. Okay, Liz, anything to add?
The only thing I'm thinking about right now is there is a directive from CMS, Medicare, Medicaid, to reduce these catheter-associated urinary tract infections, and because we would be able to do that, that's something that's actually mandated by Medicare and Medicaid, and there are fines, quite hefty fines, in hospitals right now, hospitals that don't mitigate those UTIs very well. So
Okay.
there are
Several
some pretty
$100
big
million
expenses there.
in fines. So the hospitals carry that burden themselves.
Okay.
They can't pass it on to patients or
Yeah.
insurance.
So there's a regulatory play on this as well. Interesting. So if somebody wants to get in touch with you, I have www.glrmedical.net as your website. Is that correct?
Yes.
And so go to www.glrmedical.net if you want to learn more about the company. And I suppose your contact information is on there as well?
Yeah, there's a phone number for us that we would get back to you on. And I think if they're connected through you, they could actually send us an email directly. So
Okay. Terrific. Well, thanks for your participation and Why Should I Invest podcast. I appreciate it very much. And, you guys have a great day and congratulations on this really interesting product and the great progress that you've been able to make.
Thanks for having us, Tom.
thanks, Tom.
For more information about how you can get involved in the ICAN mission, please contact me directly via email at tomdenning@icanhub.net.